Pericarditis. The term is indicating the inflammation of pericardium. But what is pericardium? Pericardium is a serous lining that lines the heart, and it has two layers. One is the visceral layer and other is the parietal layer. The visceral layer is present immediately after the heart, and between the visceral and parietal layer there is small amount of fluid, and this fluid is known as pericardial fluid, and normally it is approximately 30 to 50 ml. So now let's move towards the pericarditis. In pericarditis, the pain is fixed and sharp, and it increases on lying down and decreases on leaning forward, and it is associated with pericardial rub. So in this video we are going to deal with a classification on the basis of exudate. So we have 6 types here. Let's start with the first one, that is serous type. In serous type, the injury is mild. If there is mild injury, then the inflammation that followed the injury is also small. So the mediators that are going to be released are also low in number. As a result, there is only fluid exudation. The protein component here will be low. Because if the mediators are small as compared to increasing number like that we will see in the fibrinous, then the spaces between the endothelial cells of the capillary lining are not that much as compared to fibrinous. So there is approximately not fibrinogen is going to release out. So in case of serous, the exudate here is serous straw colored. In fibrinous serous, the injury is a little bit more, so the fluid will be present, but there is fibrin as well. But in case of the fibrinous, there is a large amount of mediators, large injuries here. So a large amount of fibrin and with very low fluid is present here, and the fibrinogen it is converted into fibrin and further steps. Okay, suppurative type. In suppurative type, we have pus. This pus, it consists of dead and dying as well as alive bacteria, our functional cells there, and our inflammatory cells like neutrophils, etc. And hemorrhagic type. In hemorrhagic type, the blood it actually consists of blood mixed exudate. There is release of serous fluid as well as release of blood. So here the exudate consists of both. Okay, in caseous necrosis, we know that there will be caseous necrotic material. Okay, now let's move toward the second type, that is our gross feature. In serous type, there will be shining and glistening surface. In fibrinous serous, the surface will be shaggy with thin fibrin. In fibrinous, that is known as bread and butter appearance is visible. In suppurative, the surface is opaque and rough. In hemorrhagic type, darker fluid is visible, whereas in case of caseous, we have yellow-white cheesy material. Next is the microscopic picture, and it is directly related with the level of inflammation, level of injury. So the inflammatory cells in the serous type, the RBC and protein is low as compared to here and here. And that's because the level of injury increases down here. In case of suppurative type, we will find neutrophils, bacteria, and fibrin. And in case of hemorrhagic pericarditis, there are RBCs and inflammatory cells. And in the caseous type, you all know there will be granulous formations. Okay, now let's deal with the causes. Yes, that's very... The causes of the first two are approximately the same. There is viral infection, rheumatic fever, SLE, uremia, and tumor, and they are approximately the same here, but the damage caused by these is greater as compared to in this. But here in the fibrinous, we have other types as well. Here we have acute myocardial infarction. So the necrotic tissue is going to cause inflammation of the pericardium. And Dressler syndrome, that there is necrosis of the part of the heart, and as a result of necrosis, the cardiac antigen are released, and then these antigens, they are recognized by our immune system, and antibodies are formed, and these antibodies, they attack on the pericardium and pleural, resulting in the pleural effusion or pericarditis, pericardial effusion. And uremia, radiation and trauma, they're also responsible for fibrinous pericarditis. Then we have cardiac surgery. Cardiac surgery is also present in case of hemorrhagic pericarditis. In case of the suppurative, we have pus-forming bacteria that includes streptococcus, staphylococcus, and septicemia can be a cause. If I move further down, then in case of hemorrhagic malignancy, like the breast CA, the uterine, ovarian CA, so they are the most common causes of hemorrhagic pericarditis. TB can also cause hemorrhagic pericarditis, and TB is also the cause of caseous necrosis. And then we have severe uremia and cardiac surgery. So in case of serous pericarditis, the amount of fluid is approximately 50 to 200 ml, and it mostly there is no complication. But in case of the fibrinous pericarditis, there can be complete recovery, or there can be organization that can occur. And suppurative pericarditis with caseous pericarditis, they are mostly these star ones. Their major complication is constrictive pericarditis, and constrictive pericarditis results in diastolic dysfunction. The heart is actually enclosed in a fibrocalcific structure. So the most common pericarditis that occurs is this Fibrinous serous or Fibrinous. All about the pericarditis. Hope you will like this video. If you like this video, click on the like button and also subscribe to the channel. Thank you so much for watching this video.